So with no further ado, I'm actually going to hand this over to Dr. Vish Nene, who's a co-leader of animal health at ILRI, focusing on vaccines and diagnostics. Vish, please take it away.
Oops, sorry. Hi. Sorry, Kay, can you see my presentation?
No, we can't see your desktop.
Okay.
Which is beautiful, but
is it there now?
No. Basically, you're seeing this. You need to expand your.
Okay. Let me start again. I'm sorry about that. I thought I had it done. Oops. No. I thought I had it all sorted out as usual. This is going to take in a few minutes, isn't it? Sorry about this, guys.
No problem. We are all very familiar with the challenges of Zoom at times.
Okay. What am I sharing here? I think I'm on the wrong side even. Okay. Actually, I'm going to ask Tim, because Tim also has some of my slides. Okay,
hello, everyone.
Hold on. I think I might have it finally. Can you see this?
Yes.
Yeah, you're not in the presentation mode though.
Oh, okay. Sorry.
Perfect.
It's fine. It's fine.
Wow. Apologies for that. Thanks, Kay, and apologies to everybody. Hi, everybody. My name is Vish Nene, and I co-lead the Animal and Human Health Program at ILRI. We've had a really interesting series of presentations and discussions on different topics under the title of One Health Security. And so it's my pleasure now to welcome you and moderate a session on vaccines and diagnostics, looking at how these could safeguard against emerging and re-emerging veterinary and zoonotic diseases. Now, given the current COVID pandemic, there should really be little need to highlight the importance of vaccines. And as we've seen, vaccines save lives, and diagnostics are equally important, first in terms of identifying the cause of disease, and second in terms of identifying the presence and emergence of pathogen variants, which we have seen during the current pandemic. Now, just as in human medicine, vaccines are important in preventing loss of animal lives, but they also have important applications in increasing the productivity of livestock and in contributing to the UN Sustainable Development Goals by improving the livelihoods of resource-poor farmers. Now, multiple benefits are associated with livestock vaccines. For example, they allow better utilization of food, they improve animal welfare, they protect the quality and nutritional value of animal source foods and their access to international trade. They safeguard against climate-sensitive diseases, for example, those transmitted by ticks and mosquitoes. And livestock vaccines can underpin the tenets of One Health by reducing zoonoses and also the overuse of antimicrobial drugs, especially antibiotics. Now, unfortunately, many livestock diseases represent neglected problems in Africa, and development of livestock vaccines is hindered by several factors. For example, many diseases are exotic to high-income countries, and thus they do not receive adequate research attention, as they are viewed as high-risk investments by vaccine manufacturers. Vaccines must also meet low-cost structures, often cents per dose. This is to increase farmer willingness to pay for them. And as a result of all of this, there's been little room for innovation or incentives for application of new science to overcome many endemic and zoonotic disease constraints to livestock health in Africa. Now, although the emphasis today is on diseases from an animal perspective, I think it's important to highlight that there are a great deal of overlap in vaccine and diagnostic technologies as applied to human and veterinary medicines. And so there are lots of opportunities to develop a novel generation of vaccines and diagnostics using new science, many of them derived from adopting advances in human biomedical science. To help me in this session, I have recruited 3 panel members. Well, actually, there were initially 4. Unfortunately, 2 of them, Dr. Anand, Kumar, and George Wairimwe, were unable to attend due to medical reasons, and we hope them a fast recovery. But online, we have Dr. Jackie McGlad, who's from Strathmore University Business School in Kenya, and we have Dr. Tim Connelley, who's from the Rosalind Institute from the University of Edinburgh. What I will ask is if people in the audience want to post any questions, please do so in the chat. But before we go to an open discussion, Tim is going to help me with setting the scene a little bit more in some of the considerations on vaccines and diagnostics. So over to you, Tim.
Thanks, Vish. Hopefully, oh, I'm on camera there. Okay, so I'll just start by putting up some slides to highlight some of the topics I think probably are of use to discuss. Can people see my slides at the moment?
Yes.
Yeah, okay. So as I'm sure most of you are aware, the actual development of vaccines is complex and has traditionally been a very long-term process. And I think there's been lots of references to the influence of COVID and the response to COVID, reforming how we think about approach to disease management and biosecurity. And I suppose the message that we predominantly are taken away from the COVID experience is that when there is an overwhelming need, especially if that overwhelming need affects the richer parts of the world, then it is possible to rapidly develop vaccines and diagnostics that we can then utilize to manage and get control of urgent biosecurity challenges such as the COVID pandemic. So that's a really positive message to take away. However, I do have 2 slightly more depressing messages to take away from the COVID experience. The first is that it is absolutely critical to remember that those vaccines did not miraculously appear overnight. They weren't just suddenly thought up on a Monday morning and hey ho, we had vaccines. They were based on fundamental biological research that had been taken over about 20 years previously. So some of that research was undertaken with the context of being prepared for pandemics. And I think it's important that we don't get complacent in thinking that we can make vaccines now. And my other kind of more negative message again is that we were lucky. COVID is actually a fairly easy pathogen to make a vaccine against. There's one target molecule that covers the surface of the pathogen, and antibodies are sufficient to give us protective immunity. Now that isn't the case for lots of other pathogens, and actually trying to conceptualize how you would develop an equivalent vaccine for other pathogens is really difficult. I suppose the easy example to make is with the influenza. We do have vaccines available, but they're very strain specific, and that requires a lot more thought about how you would actually engender those vaccines in a rapid way. So I think there is a moment of triumph for vaccinology in the fact that we have managed to generate vaccines so quickly in response to the pandemic, but there are also, I think, key messages that the game isn't over. We can't develop rapid vaccines for everything, and that success was based on a lot of previous work. And I think that's the key message to bring to the fore whenever we're talking about how to prepare for future pandemics. There is a lot of work still to do. Okay, so that's the lesson from COVID, but the lessons from the rest of history is that development and deployment of vaccines and diagnostics are often hindered by a whole range of issues. So be that the incomplete understanding and gaps in our knowledge of the biology of both the pathogens and also of the host responses to those pathogens, be that in the ability to rapidly scale up production of vaccines and the biomanufacturing processes that are involved, a lot of vaccines that kind of manage to induce protection aren't actually feasible to use. And therefore, that's another careful consideration that needs to come into it. And then, as has been discussed in various other topics in this workshop, there's the issues of economics. How much can a vaccine cost before it is made inaccessible to the people that need to use it? The policies and people's own personal perceptions of what vaccines do and how they should be used, and how you integrate vaccines into the broader biosecurity scenarios. So there's lots of issues that can influence our ability and willingness to develop and use vaccines, and they are key to address. And that feeds into a lot of the discussions that we've just had about social interactions around biosecurity. So I suppose the next question when it comes to vaccines and pandemic preparedness is, what is the next pandemic? I suppose there is always the disease X, as COVID was, something we didn't know was coming down the line. I think from a more pragmatic point of view, there's also things like antimicrobial resistance. As I'm sure many of you are aware, there's a report out today in the Lancet that's looking about the extreme costs of antimicrobial resistant development and how that's causing huge numbers of death in humans. And it's recognized as a One Health issue. The antibiotics are shared between veterinary and human use, and whatever happens in the animal biomedical sphere will also influence humans. So it might be that we're looking for the next pandemic to come around the corner, but actually we know what it is and it's there already. It may be more of a slow burn than the COVID pandemic, but actually is as potentially devastating as COVID or any disease X may be. So in the context of all that, I suppose we have to be very aware that there are limited resources. And the key question is, how do we make the best use of those resources? So as Vish was saying, I think we're very fortunate in this area that for a lot of the technical aspects, there is huge opportunities for crossover between human and veterinary vaccine development. And that's something that I think people have been aware of for a while, and there is lots of efforts to make sure that there is good integration between human and veterinary research in this area. And that really needs to remain at the forefront of our thoughts going forward. I think the other thing that's been touched on by a few of the speakers in the sessions on the workshop is consistent and long-term strategic policy funding, the avoiding of the boom-bust funding, and actually having a long-term strategy about how you develop the infrastructure for vaccine development and deployment. And then I think the final thing to think about is, where do you focus those resources? Is it on surveillance and diagnostic use to identify new pathogen emergence? Is it on the fundamental biosensors that are necessary for the technical development of vaccines, be that in terms of antigen development or in platform development? And then the other areas, production capacity, I think very acutely aware at the moment of, even with COVID for human vaccines, that there is a bottleneck in the production and deployment of vaccines. And I come very much from the immunological end of the vaccine development spectrum, but very conscious that those bottlenecks can occur at any point in the vaccine development manufacturing pipeline. We need to be aware of all of those areas. And I think that is everything I wanted to say at the moment. Oh, sorry, last slide. And I suppose in terms for the veterinary biosafety and biosecurity in Africa, it's understanding the current situation. So what vaccines do we currently need? Are those vaccine needs being met or not met? And what are the ramifications of this? So if we can't meet vaccine need in times of non-pandemic outbreaks, how do we cope in the future? What will our need for the vaccines be on a routine basis? And is there sufficient capacity and infrastructure to respond if there is an urgent need for enhanced novel vaccines and their production? And I think is a major challenge going forward. And that really is the end of my slides, Vish. I promise that.
Hey, thanks very much, Tim. Thanks, Tim. Thanks for raising some important points and questions. I mean, the picture is not entirely negative. I mean, obviously, COVID has stimulated and accelerated a lot of research in the vaccine field per se. And I think it's fair to say that we are now at a stage where we wouldn't have been a couple of years ago. But I think one thing that also we need to stress is this took a lot of dollars, and a lot of dollars for one disease in terms of getting the vaccines and de-risking the involvement of the private sector in making those vaccines. That's something that we haven't talked about in terms of vaccines for use in the veterinary field. Jackie, are you online? And I'm wondering if you might have a few comments that you wish to make before I say a few more things. Welcome.
Thank you very much. Can you hear me all right?
Yes, thank you.
Perfect, great. Well, in fact, I sort of wish I'd been in the previous section, so I'm going to straddle a little bit between the vaccines, but also the people. It's great to be with you all. I actually carry work on through two main academic institutions here in Kenya, where I'm sitting at Strathmore with many colleagues, and also with colleagues at ILRI, where I do a number of One Health activities, reaching more between things like the value chain, the markets, the milk, and sort of how should I say, the social aspects of butchering and what actually happens on the ground in the sort of meat value chain and the milk value chains. I've got lots of horrific stories and pictures to show you, but that's not what I want to concentrate on now. But just in answer to the previous one, we do a lot of social dynamics and lots of research, collecting a lot of quantitative data around those aspects and how the value chain itself can be quantified. But what I wanted just to reflect on today was more on my other work, which is looking at various diseases that are sort of the neglected zoonoses between the wildlife and livestock. And just to sort of go back a little bit to the beginning here in Kenya, just so that people know, I mean, we literally only have 12 qualified veterinary service delivery veterinarians who are allowed to interact with wildlife. So we've got plenty of vets, but vets who are able to do things with wildlife under KWS, we only have 12. So you can imagine a very small number of people can do this kind of work. So what I've been trying to build then is a structure to support their activities so that we can look at early detection of zoonoses in the wildlife populations and how they then mix with wildlife and livestock to really understand. And so essentially, we've set up camera traps, for example, over the Mara and various places where we see that there are interactions to look at the density and how wildlife and livestock are interacting. So we've got fantastic documentation of that. We've got literally billions of pictures looking at how that happens. And we've got AI and machine learning to talk about the contact between livestock and wildlife populations. So that's really important. But then coming then into the world of vaccines and what to deal with, it's very clear that for many wildlife species and pathogens, adopting existing tests, really, it's just not an option. So what we need are some novel high throughput methods. There are some which are happening at small scale. They have successfully entered the spectrum of veterinary diagnostic applications, and some of them are being used, and this would be of huge benefit. What I can see, I'm coming from the business school side, is to try to create that market, that business setting in which we can get a lot more investment. And there I'm working with colleagues around the world to look at metagenomics, metatranscriptomics, to look at applications where we can have both human and livestock diagnostics to get them into routine microbiology laboratories. But when we have kind of spillover events or conservation efforts, particularly around endangered wildlife species, what we're seeing is that these techniques can also help in herd management, because we could then have early detection of zoonotic pathogens and diseases. So, and consequently early interventions. So what I'm trying to build at Strathmore in a kind of One Health context is to establish what is that background microbiome of livestock and wildlife animals, sort of understand what that looks like. Think about the bottleneck for routine applications of comprehensive high throughput methods in the diagnosis of diseases in wildlife. And where there we need better equipped laboratories, we need trained staff, high quality reference databases. And then how can we share those to really make sure that we can respond to new diseases? And we're not, because at the moment, there's a bit of a bias towards emerging zoonoses, which have got a high perceived threat to human health, important, but I still see that we need to get the veterinary side much better equipped. But just to finalize, I deal a lot with pastoralists, and there's such a poor understanding of vaccines amongst pastoralists. I'll be quite honest. I mean, when I go out, sometimes I'm horrified when I see the bottles on the ground that have been deployed in the herds as to what is being sold to pastoralists and livestock herders. They're just a huge range of things which are completely inappropriate for many of the animals that they're treating. So
Sure.
A massive campaign of bringing this really up to the forefront would be fantastic. COVID is a really good thing, by the way, because a lot of people who did not believe in vaccination now have been vaccinated themselves and now are saying, how can I vaccinate my animals? So it's an interesting switch in people's perceptions about the efficacy of what a vaccine does. Thank you.
Sure. Thanks very much. I think you raised very many interesting points. I mean, from a pandemic perspective, inevitably it focuses on the human side. And so those pathogens which have human pandemic potential from the zoonosis perspectives tend to get the dollars. I think that the surveillance issue that you discussed is a really interesting one. Unfortunately, we haven't had time to talk about diagnostics very much in this session. But if you think about it, diagnostics are available. It's not a question that diagnostics are not available. It's a point that they're extremely expensive. And it comes back to the same situation for surveillance as well as use of diagnostics. Who's going to pay for the bill? Who's going to pay that bill? I think the technical solutions are available. It's the willingness to make the money available to be able to employ all those technologies in an appropriate fashion so that we can actually safeguard the future. I can see that Kay has come back online, so I suspect that that's a hint for me to kind of wrap up this session. So thanks very much, Tim and Jackie, for being panel members and for raising really pertinent issues. And I hope that this was of interest to the audience. And with that, I hand back to you, Kay.
Vish and panel members, this was an excellent discussion, and it really nicely sets the stage for